Hi, this is Dr. Michael Berglund, and you're here today with me. I'm going to talk to you about healthcare. You're like, oh, we get so much healthcare in the news, healthcare in politics. What's the deal with healthcare? Can't we just fix it? It's more complicated than that. Here's the thing. Healthcare involves obviously treating patients. And patients have a wide spectrum of needs. The problem is that right now we have a monopoly, right? And you think, well, you don't have a monopoly. I see physical therapists, I have surgeons, but it's all part of a single system called allopathic medicine. It's all part of medical doctor system. So you're saying a podiatrist, he's a doctor of podiatry, but he falls under the medical system. The physical therapist falls under the medical system. The optometrist and the ophthalmologist and the surgeon and the endocrinologist and cardiologist, they all fall into the medical system. Everybody has the same paradigm. You say, well, that's a fancy word. Well, it's a system, right? It's the belief system that everything comes out of for those people. Now, you may say, well, what are the other options? You're not going to talk about some new age guru or something that's going to sit and chant with me, right? No, there's alternative systems like acupuncture, like herbs, like chiropractic, and those things that have existed for generations, for hundreds and sometimes even thousands of years, and they've been in existence. There's midwifery, right? So we have OBGYNs that deliver babies, but midwives also deliver babies and are licensed in many states to deliver babies. The difference is they can't do surgery. Now some people say, well, that's a disadvantage, but some patients would see that as an advantage. They would think, well, this person's going to try everything they know how to do to make sure this baby gets delivered without a C-section. And some people would like that. Some people would like to know that they've tried everything before they go to surgery. Here's the thing. When it comes to the medical system, there are some really positive things associated with it. And you know what they are. They're like, if I get a gunshot wound, or if I have a knife sticking out of my back, or I have my legs broken in 15 spots, I need a medical doctor. If I code blue, if I'm dying, I need a medical doctor. I'm not going to have an acupuncturist, I'm not going to have a chiropractor, I'm going to have a massage therapist treat me. I need a medical doctor. Okay? Everybody needs those people in those situations. However, there are instances where restorative care is necessary. You're like, restorative care, what's that? That's where we take where the body has gone off track and we try and bring it back. And we do this with a variety of techniques. It can be, again, depending on if it's an acupuncturist, if it's a chiropractor, if it's a naturopath, we try and restore normal function, or we try and work with the systems in place like a midwife would do. So here's the thing. Why I'm talking to you today is there is a holistic healthcare initiative going on in Massachusetts right now. What we're trying to do is give the patient the choice to choose who they want to see within a system. This breaks the monopoly. Choice, in most areas of free market, if you talk to most economists, will say it brings about two things: better quality, right, and lower cost. And we need, in our healthcare, better quality and lower cost. The next stage, of course, is the third-party payer system, which allows the patient to have a participating level in paying for their care. Because once people pay for their care, they realize how expensive it is, and then they want to actually try and find ways to do DIY, to do it themselves and keep their own health rather than going and getting a doctor to be in control of them. But that's a whole nother subject for a whole nother day. This is Dr. Michael Berglund. I'm here in Kenosha, Wisconsin, and I want to help you in Massachusetts get choice.